Kenya has been straining to provide life-prolonging antiretroviral drugs for years to the growing HIV-positive population, a situation occasioned by hitches in ARV funding after the health ministries failed to secure millions of shillings from the Global Fund. Fortunately, this year, Kenya managed to secure 9.5 billion shillings, which had been frozen pending a court case. And now the Global Fund has given Kenya a green light to manufacture ARVs.
The procurement process of these drugs take about minimum of 7 months from the time a tender is placed. So definitely if we have a local manufacturing plant, that will be cheaper.
The Kenya Medical Supplies Agency, KEMSA, will be responsible for the new task. Stakeholders are, however, cautiously optimistic about the new development. They fear that counterfeits may flood the market or the manufacturer could compromise quality for profits.
There is a caveat that I like to mention that worries me. In the olden days, we had drugs that we used for STDs, and unfortunately, some of the drugs that were made locally were not actually up to standard.
Manufacturing substandard ARVs will introduce Kenya to a whole new disaster of HIV drug resistance.
Because antiretrovirals are not multivitamins, or what I would say, food supplements, and they're not painkillers. Immediately you start having pills that don't measure to whatever I'll call the national standards or in the international standards, then you have a risk of resistance.
They must be WHO pre-qualified, they must be approved and licensed by the Kenyan Pharmacy Board, as well as other stringent conditions. So we are very, very hopeful that we'll be able to get quality drugs for HIV/AIDS patients.
400,000 Kenyans are currently accessing antiretroviral therapy. 300,000 others are also eligible but are yet to be started on the drugs. Currently, 1.4 million Kenyans are HIV positive. Sylvia Chebet, Citizen Live at 9.